when it comes to parenting as well? What are any specific projects that Save the Children is working on when it comes to disseminating information, especially to parents, because that's where the education is needed. It starts from home, and obviously the kids are going to look up to their parents before they go to school. Once they go to school, they look to their teachers for information and guidance. But at home, it's parents.
So one of our flagship programs is Parenting Without Violence.
Yeah.
And that covers a whole range. So first of all, it's the obvious is, don't hit your children.
Yeah.
But also I think, having positive discipline. So even yelling at a child has almost the same effect on their young brains as beating them. So constant shouting, berating. So I think it's really introducing to parents both men and women, mothers and fathers, and grandmothers, because they play a really important role in a lot of places, about really positive ways to interact with their children. This includes everything from nutrition support, like what should children be eating for a healthy diet. Even sometimes it takes the form of interfamily counseling. How can you talk to each other? How can you make decisions together? Because, studies have proven when the mother, the father, the grandfather, they all are making decisions together about money or medicine or schooling, they end up being much better decisions for the children. So it covers a whole range, and we talk about child marriage and the harms that can do. And there's been huge improvements in Nepal around ending child marriage, which is really exciting. But we also talk about, other forms of violence, both physical and mental. And this also includes watching your children at school, because sometimes it's the parents who may notice first that there's bullying or problems or the child's not doing well in school, and then they need to be advocates for their children at the school.
Yeah. In the same context, I am a premature baby. I'm born in 7 months at home. So it's very close to my heart when it comes to understanding how we can make it better. Well, I was born in Kathmandu, so my parents probably had access to almost everything. And regardless, I decided to show up at home. When it comes to the health system that we have on today's date, within the 77 districts, how far have we reached when it comes to providing health facilities for families, for mothers especially, for a newborn child? Are we working on do we have a special project towards that?
Yes. So prematurity is a huge issue globally.
Yeah.
The biggest killer of children under 5, actually, which people don't realize. And Nepal, I think, ranks number 20 for premature births. No one quite knows why that's as high as it is in Nepal. So certainly an issue, and an issue that covers the whole country.
Yeah.
So we have a number of different programs that we're working on. So one is a system strengthening program with USAID, and that's in Karnali and Lumbini.
Yeah.
And working with the existing kind of government healthcare systems to strengthen it overall, with a particular focus on maternal newborn child health, which sounds very NGO-ish and technical.
No.
But basically, it's making sure that, first of all, that there are actually a fair amount of clinics in Nepal. It's quite difficult to access some of them because of the rocky terrain or where people live. But it's also making sure that when you arrive, you have sufficient care. You have people who are trained and know what to do.
Yeah.
Every province should have a hospital that has, care for small and sick newborns. And actually, the rates of newborn deaths have gone down a huge amount in Nepal.
Yeah.
But where there's still a lot to be done is the small and sick newborns. So, and these are premature or illness. So really making sure that in every single province, at least, there's a hospital that can adequately care. But also some of the interventions are really simple. You don't always need kind of fancy high tech. Sometimes it's breastfeeding practices or making sure that the children are fed correctly from the beginning. We used to advocate kind of these heating beds for small premature babies because they can't regulate their own heat. Now we're saying the perfect heat is kangaroo care against the mother or father's body, because that regulates them perfectly. So through these different techniques, we've made huge progress, but there's a lot still to be done here.
Exactly.
And I think it's hardest for people who live in really remote. Hard-to-access areas. Yeah. I just went and visited a health facility and some schools up in rural Karnali. And I consider myself fairly in shape. But after hiking half a day to get to one of them, I thought, wow, now imagine doing this 9 months pregnant or in labor or other things. So it really, I think, brings home that we need to make sure this is accessible to everyone, But also when you arrive, you need to be sure you're getting the right care.